Hello and welcome to this episode of Health in You. I am Sumi Sukanya Datta, and today's topic for discussion is the global Mpox crisis, which hit home recently when the first patient of the disease in the current outbreak was identified in India. To discuss this, we have two illustrious guests, senior virologist Dr. Shahid Jamil and biologist Dr. Anurag Agarwal. Dr. Jamil is associated with the universities of Oxford and Ashoka, and Dr. Agarwal is also with Ashoka University. Thank you so much, Dr. Jamil and Dr. Agarwal, for joining us in this discussion today.
Pleasure to be here.
So, we have been hearing a lot about Mpox. Dr. Jamil, I would like to start with you. This Mpox was earlier called monkeypox when the first time it started in the current scenario in 2022. What is the new development now, and why did the WHO declare it as a public health emergency of international concern?
It's not a new development. We just have short memories. In 2022 as well, WHO had declared it as a public health emergency of international concern. And then it sort of waned off and we forgot about it. So the development that has happened now is that since 22, when there was a global epidemic, it was a clade 2 virus which was circulating. But the virus apparently sometime in 2023 has mutated into what we call clade 1b virus. And it essentially means that it's transmitting better between humans. So it's more contagious. And that's why WHO declared another emergency recently. But just before that WHO declaration, the African CDC and the Africa group had already declared it as a public health emergency in the African region. So it's been going around. I mean, the virus has been endemic in Africa, but Africa being Africa is off the radar of international public health and, more importantly, international financial centers and centers of international politics.
Yeah.
So it has more to do with politics and money than disease.
Okay. So we also hear that a lot of children are getting affected by the disease. Why is that? Could you help us understand, Dr. Agarwal, why is that? Why, compared to the 2022 outbreak, more children are now getting affected?
I don't think anyone knows why, but the fact that children are being infected is causing the concern to rise for human to human transmission. And to take a step back, when the type 2 clade basically spread all over the world, the first announcement 2022 that ended in 2023, it was primarily limited to very intimate contact. Within that, typically men having sex with men. So
Right.
there was a degree of comfort for the other communities that, look, it's not coming to us. Because if we are not in intimate contact with an infected person, we are not going to get infected. And truly, once awareness rose that this is spreading, it quickly fell down again. And as Dr. Jamil very correctly pointed out, to be very honest, much of what is creating emergency now is simply about recognition of people being risk beyond Africa. Within Africa, hundreds of cases have been going for a long time. And while the official death count of the previous international health emergency was only a couple of hundred, more than that die every year, probably in Africa, undocumented.
Right.
So this time, when children are being infected, it is clearly not intimate transmission. The vector, if any, is unclear. So whatever it is, human to human transmission cannot be excluded for certain, possibly through non-intimate transmission. And that's why people started worrying about respiratory transmission, which is what would be the real fear of everyone. So
far, is there evidence that it is?
There is no evidence.
There's no evidence of respiratory transmission.
So genomic is somehow sometimes the best evidence. So what one looks for If you see a cluster of cases from respiratory transmission, all of them will have extremely similar sequences. If you
Okay.
are missing cases in the middle of transmission, you will see large divergence of sequences. Neither is the case so far from the little work that has been done. So, as of now, we're not seeing the type of clusters that were seen in, say, SARS-CoV-2 or something else. So, even if human to human transmission is occurring, it might be coming from deep contact with an ulcer or a lesion or something like this, or through even water. Because, for example, in 2022, we did realize that you can find mpox in sewage. And one of the sources could be that when you wash lesions, you are shedding the virus. And CDC announced that sewage surveillance could be used to trace mpox. So maybe poor sanitation, maybe exposures, maybe high viral load in these areas. One does not know. But as of now, none of the large respiratory type transmission clusters that have been seen. So far, we have not seen that, as far as
Okay.
I know.
Okay.
Uh,
Dr.
let
Jamil,
me yeah let
please.
me add to what Anurag has just said. Uh, there is no evidence of respiratory transmission, but remember, this family of viruses, to which smallpox is a very illustrious member that we have completely forgotten about, there was droplet transmission. So
Yes.
when people sneeze, when people cough on a surface, you pick up contamination from the surface. Remember COVID? We talked about this
Yes,
a
when
lot
it
during
started,
COVID.
I think that is what the understanding was about COVID too, I
Yeah.
think.
And the other point about children, children are being amplified, uh, and that in one way is telling that it's not just transmitted through intimate contact, as people had thought earlier. But also remember that those of us who are 40 years or older will have protection against Mpox simply because we were vaccinated against smallpox. So, yes, young adults will get it. Young adults are susceptible to it, but children are also getting amplified because older adults are sort of a bit out of the picture. Smallpox vaccination, by the way, stopped in 1980.
Mhm.
Right. Yeah.
Yeah.
And Sumi, let me just take one point further.
Sure.
Also, a reason for more children being caught would be
Mhm.
if children were prone to getting sick. As of now, my understanding is it's not that the diagnostics are so easily available that people are being tested aggressively. So, which
Right.
basically means only when you are significantly symptomatic will testing occur. So, sometimes a bias can also come that way. Historically, the two extremes of age, very young and very old, have always been the most susceptible to infections. So the other reason could be that Africa is a young country, the number of very old people is few, the number of children is large. So simply by susceptibility to significant infection driving the testing, one can also get a bit of that. But again, like I said, until you do aggressive testing of everyone for screening the population like we do in research, or you do surveillance by method that are independent of testing, like wastewater, one would not know the answer properly.
Right. So, can you help us understand, what are the measures available at the moment if one, for instance, gets Mpox? What is the management that is offered to such patients? And also, is there a way to prevent, especially for people who may be in close proximity to such patients?
Well,
Um,
prevention, of course, vaccination. Uh, and it has been shown clearly in animal tests that the smallpox vaccine will be effective against Mpox. Even a single dose of the smallpox vaccine has been shown to prevent infection in the monkey model. Now, this hasn't really been tested clinically uh, in humans, but in an emergency type situation, the smallpox vaccine will be able to give protection against Mpox.
Right.
Having said that, the clear problem is that Africa, for example, needs about 10 million doses of a vaccine to control the outbreak. And what Africa has so far available is only about 280,000 doses, which is less than 3% of what Africa needs. On the other hand, there are countries that produce the vaccine and are stockpiling the vaccine in case there is a smallpox outbreak. I think that's criminal. That shouldn't be there. Get vaccines, donate vaccines to Africa, and control the outbreak at the source.
Right.
We shouldn't really be talking about this, how to prevent transmission, this, that, if you control the outbreak at the source.
Right. So you were saying that it should be given at places where there are large outbreaks happening, whereas in other countries there may not be a need for a large scale vaccination as yet.
Absolutely. Absolutely. And we've seen this again and again. We saw this during COVID. Countries stockpiled 5 times the size of their population. And the same countries are doing it again for Mpox. That's
Right.
why I keep saying that it's a problem of politics and money and less about disease.
Yeah. So a lot of diseases, new diseases especially, which are coming these days, are being linked to climate change. It happened in case of SARS-CoV-2, then bird flu, and now Mpox too. Please help our viewers understand how is it related. Do you think it's related, and if yes, how? Dr. Agarwal and Dr. Jamil, please do both listen.
I mean, climate change is creating new mixing between humans and animals. That's one. But very important, I would argue that the things that we have done that caused climate change are also the ones that are leading to many of these things. So very large scale, growing of animals, close in contact, very large scale growth of the population of this world, um, eradication of habitats where animals used to be. These are both causing climate change and causing these kinds of things together at the same time. I won't necessarily argue that climate change is causing it, but there are lots of shared factors between everything. And I'm sure Shahid can add more to this.
Yeah, please.
No, I agree with you, Anurag, completely. I think look at the reservoir for Mpox, for example. We don't really know what the reservoir is, but there is a good suspicion that it is the small rodents that live in forests, rats, animals belonging to similar families. And one of the things that is causing climate change is deforestation. And when you do deforestation, you don't just cut down trees, you destroy a whole ecosystem. Small rodents that live at the bottom of the forest, they also get away from the forest and closer to human habitations. So possibly this is one reason why something like monkeypox, or I shouldn't say monkeypox, Mpox has moved into humans. It has nothing to do with monkeys, by the way. Monkeys are not the source of transmission. And that's the reason WHO went away from the terminology of monkeypox to Mpox.
Right.
So possibly rodents linked to deforestation.
So at this stage, as we know, is that while the outbreak is very large in Africa, there are sporadic cases in some other countries, including India and some countries in Europe, US as well. So do you think this outbreak turning into a major pandemic, does it have pandemic potential by any chance as we know it now? So Dr. Jamil, sir.
Well, if you let the virus run rampant in areas where there are many more cases, then you have far more opportunity for the virus to mutate into something that will transmit even better.
Right.
So that's why I keep saying control it at the source, and you still have the opportunity and you have the tools to control it at the source. You don't have the will to control it at the source. One case in Sweden caused all this, Hallagulla about Mpox. 15,000 cases and about 500 deaths annually in Democratic Republic of Congo have not uh, created the kind of attention that one case in Sweden has.
Right.
What is this? Isn't it racism? What is it?
Yeah. Dr. Agarwal, would you also like to add something
I
here?
mean, so your words pandemic potential, it has all the characteristics in general, right? It's from a family of viruses known to have created pandemics, known to have transmitted very aggressively in a very infectious way and killed people. We have seen its ability to spread in one geography. So, really, there is something that is limiting its spread to other geographies. That's the only way one sees it. One could be it is dependent on a particular intermediary host, like the small
Right.
rodents Shahid talked about, but it can adapt. It can find new hosts that could carry it across the world, or it could simply learn to jump more effectively from human to human.
Yeah.
And you give it enough chance to explore all of its evolution potential through large number of infections, eventually it will. It's really a statistical thing that every time a new infection occurs, the likelihood of a potentially bad mutation is there. It's a very low probability. So, one case it's very low, 1,000 case it is still low. As you go to 10,000, 100,000 over years, sooner or later, it will find that mutation.
Right.
And so exactly what Dr. Jamil said, I mean that I think not cutting it off at the source, reducing its chances to find that path that makes it a more dangerous virus is the only way to go. And we have the resources, not that we don't have the resources. There are vaccines, just that Africa doesn't have it. So we just need to get it to where it belongs, and then the rest of the world is safe. If the rest of the world sits thinking it will be safe, it's not.
Yeah. So at the moment, it's very we can only assume things, but God forbid if it turns into a pandemic, as I asked. Do you think India is in any way better prepared to tackle the crisis? Because there have been a lot of talks about One Health. Now, the best people who can answer this would be the policymakers, the government, people in the government. But from outside, if you could, just share your opinion, Dr. Jamil, what do you think about, India's preparation for any future pandemic, so to say?
Well, I think coming at the back of COVID, there is certainly awareness, and I do feel there is awareness uh, at the appropriate levels in government uh, to deal with it. Remember, there are five important things in preventing, uh, large outbreaks.
Right.
You need to have a strong public health workforce. India has a reasonable size public health workforce, but I wouldn't say that it's very well trained or a strong workforce. So we need to work on that. You need stronger public health institutions. Again, uh, what uh, the process is important. The institutions are important. So let's work at empowering institutions. Uh, we have a National Center for Disease Control. We should ask, is it empowered enough? I don't think so. I think it needs to be independent, it needs to be funded better, it needs to be empowered. Uh, you need to have good manufacturing capability for vaccines, diagnostics, and therapeutics. Thankfully, India is in a very good position that way, and COVID showed us this. Uh, you need to provide domestic resources for health security. And again, this goes back to empowering institutions, funding institutions.
Right.
And finally, I think globally and even locally, you should have respect for partnerships and action oriented partnerships. Uh, we didn't do very well during COVID. Uh, we did not share data very well. Uh, Government agencies did not show much respect for people in the, who were independent outside of government institutions. So that needs to be strengthened in India. I think if we, of the five pillars, manufacturing, we're doing very well. We need to worry about the other four.
Yeah. Dr. Agarwal, would you also like to say something on this?
Yeah, sure. I mean, the question was, are we better prepared? Yeah, definitely better prepared, because the experience of the pandemic did give us a huge amount of manufacturing capacity, as Dr. Jamil pointed out. It has at least led to the creation of the National Institute of One Health, which is a multi ministry institute that currently, while ICMR is in charge of, it has been very clear from the way it has been set up that all ministries are stakeholders. So, hopefully, the process of getting permissions, etc., will become easier with interministerial cooperation. But then, on the other hand, the institute is not physically quite there yet. It is a idea and a very good idea, but it is yet to develop fully. We do have confusions at times regarding what is the responsible agency, and that part certainly could do better. And I actually agree with Dr. Jamil that, really speaking, this is the mandate of the NCDC, and strengthening and enabling the NCDC, and by and large, the dealing with any infection that can spread is a question of funding, not only of the diagnostic and all these systems, but also the healthcare system. So the public health system of India in general, everything from diagnostic to prevention to therapeutic, could certainly do with more funds. And while we have been continuously moving steps in the right direction for inpatient care, PMJ, you heard about the plus 70 plus schemes, there are still a lot of people who need to be covered better. And so we need to see greater investments. And I think that investments is what I would really like to focus on the most. Yeah.
Yeah. With that, we wrap up this show. Really appreciate Dr. Jamil and Dr. Anurag taking out time for this. Thank you so much, sir.
Thank
Thank
you.
you.
Thank you, sir. Thank you, sir.